So a major influence for me going into medicine was my dad. So he's a retina surgeon, so an eye surgeon. But for him, going and seeing patients with him in clinic or going to his office and seeing how he interacted with people and how he improved their lives was huge to me. The other thing that really stuck with me was my dad always teaching me, you want to give your patients the best entertainment value for their healthcare dollar. You're going to talk about serious things in medicine, especially in vascular surgery, but you want to make it relatable and you want to be able to make your patients feel at ease and help them understand what's going on. My job isn't just to do really complex things and really complex anatomy. It's to help them understand what's going on with them, what their options are to get better, and then how to move forward from there. Patient care to me is all about making that connection. A lot of people come to me and they say, well, I don't even know why I'm here. My doctor so-and-so sent me here. And it's helping them understand what's going on with their anatomy that might be causing the problems or symptoms that they're having. Be it a swollen leg, be it, an inability to walk, pain in their stomach from, a blockage in the artery that goes to their bowels, helping them understand the anatomy that's causing it, helping them understand how that's impacting them, and then helping them understand the treatment options. It's to help them kind of navigate the process and figure out what works best for them. So for some patients, they're not going to be a candidate for major operation. Other patients aren't going to want anything done, but you have to help guide them as to understanding of if we don't do anything now, it's going to get worse in the future. The other thing that I really like about medicine is that, I'm a fourth generation pilot. My great grandfather flew for the RCAF as a volunteer. My grandfather flew for the US Navy. My dad flies privately and for business and do medical relief work. I've been flying since I was a teenager. And so a lot of kids, when they're growing up, martial arts is how they get their sense of focus and their discipline and their organization. For me, it was being in the cockpit. Checklists are your friend. Plan your flight, fly your plan. That's a classic Wagner family motto. I bring that same approach when I'm in the operating room or I'm in clinic. I'd like to have my protocols. I like to have my, set checklist items that we have to do. I never want to have to worry about having missed anything. There are certain things, be it crew resource management or being able to work well as a team, that matter in having good communication pathways. And that also applies to how you interact with patients and their family members. And so the nice thing is that the same principles that help you be safe in both environments, I get to use, in both directions. I'm Dr. Jason Wagner. I'm a vascular surgeon at Sarasota Vascular Specialists.